Starting next week, Kenyans receiving treatment at private hospitals through NHIF will have to cater for the expenses out of their pockets. This is following the announcement from the Kenya Association of Private Hospitals that it will no longer accept NHIF payments. The decision is said to have been arrived at following disagreements between NHIF and private hospitals over payment of various services catered for by NHIF. It is a move that has raised concern among stakeholders in the health sector, who say poor Kenyans will bear the greatest brunt in the brawl between the NHIF and private hospitals.
NHIF and the private hospitals is an issue that has been brought about by differences in the charging system. The payment system for procedures that are done, especially the surgical procedures. There was expectation that before the new contracts that NHIF has given, there would be a round table to be able to renegotiate on some of the terms that have been provided in the previous contracts. You know that the contracts for the private hospitals with NHIF usually expire after every 3 years. And so if anything is to be altered in these contracts, then there is need for the association, for the professional associations also, which cater for healthcare providers, who are the clinicians that provide the services and the procedures, to come to the table and renegotiate.
Kenya Association of Private Hospitals Secretary General Timothy Olwenyi says that they came to the decision due to the new terms of engagements that do not favor their cause. The private hospitals' latest decision will now compel many to switch to public hospitals, despite the fact that a majority of public hospitals lack specialized equipment and experience the challenge of congestion.
Sasa hapa tunakuja, lakini hata hapa madaktari wetu hapa ni wazuri, lakini madawa kupata ni shida.
Yeah, of course Kenyans are going to suffer because you find that in our country somehow we have neglected our public health facilities in such that we do not have the adequate and appropriate health providers in public hospitals, and that is why most of the time Kenyans will be pushed to the private hospitals. What happens now is that those who cannot afford will actually be compelled to go to the understaffed public hospitals. You overload the clinicians who will be seeing patients in public hospitals. You are then going to see long waiting hours.
Stakeholders in the health sector say that this is a setback to universal health coverage, which is among President Uhuru Kenyatta's Big Four agenda.
We are going into a new NHIF where more Kenyans are actually going to be contributing. It's going to manage probably double the amount of money that we had, with the hope that we are going to actually use this fund to be able to fund universal health coverage and be able to provide affordable, accessible and quality services for all Kenyans. To do that, we must ensure that the people who are providing these services are then taken care of, so that they can provide the services without having to suffer the disadvantage of that lowered fee.
Their only plea is for the two critical agencies to come together and reach an agreement that will favor both parties.
The lasting solution in this is just sitting with the association for the private hospitals, sitting with the associations and the unions in the health sector that represent the clinicians and the service providers. And then we are going to be home and dry, because once we agree, then Kenyans are not going to suffer discontinuity of service.
As the NHIF and the Kenya Association of Private Hospitals continue to differ, the common mwananchi has now been left with a bigger burden, which is to cater for all their healthcare expenses amidst the harsh economic times. And their plea is for the two bodies to come to a consensus. Lilian Kamau, Ebru TV.